Many countries struggle with the cost of healthcare. Innovating the way in which healthcare is organized and delivered is generally seen as one of the ways to keep high-quality healthcare affordable. But there are so many innovations for the healthcare sector. How do we choose which ones to adopt and which not? In this lecture, I will explain to you what economic evaluation is and how it can be helpful for decision-making in healthcare. In addition, I will discuss the importance of identifying all the relevant stakeholders and will illustrate this with the example of a real-life innovation. Healthcare helps us live longer and healthier lives. This is a great benefit. But healthcare does not come for free. Most Western countries spend between 10 and 15% of their national income on healthcare, and some countries even more. The aging of the population in these countries comes with additional challenges. Healthcare systems increasingly struggle with the cost of healthcare and therefore need to think critically about the best way to spend their limited healthcare budget. To some extent, it's like in your own household. You probably cannot afford all the products and services you want from your monthly income. Therefore, each month, you need to decide about the best way to spend your income and perhaps set aside some savings for a rainy day. How do you make such decisions? In healthcare, such decisions are complicated. For example, decisions about which services or innovations to adopt usually involve choices between groups of patients. Which patients will you help and which not? And what are the consequences for these patients from not receiving the help they need? These are fundamental choices. A growing number of countries uses economic evaluations to inform such difficult decisions. Therefore, for anyone with an interest in the provision of healthcare services, understanding how economic evaluations in the healthcare sector work is really important. Economic evaluations provide systematic information about the costs and benefits of a service as compared to an alternative. For example, what are the costs and benefits of an innovation compared to an existing service for the same patient population? Why is this information important? Well, if you work with a fixed budget, spending on a new service means that you have to spend less on an existing service. After all, you can spend your money only once. This is called displacement. Therefore, you obviously want to know whether the new service provides more benefits than you will lose from reducing the existing service. In other words, does the new service provide better value for money than the existing one? If it does, decision makers may be inclined to adopt it. But if it doesn't, they probably won't. Let me give two examples. An economic evaluation could show that a new service improves the efficiency of care provision. This means that you could provide the same care for less money or provide more care for the same money. That sounds like a good opportunity. An economic evaluation could also show that a new service improves the quality of care at the same costs. This also means better value for money. In the healthcare sector, economic evaluations fit into a broader multidisciplinary approach called Health Technology Assessment, or HTA. UNETA, the European Network for Health Technology Assessment, defined HTA as a multidisciplinary process that summarizes information about the medical, social, economic and ethical issues related to the use of health technology in a systematic, transparent, unbiased, robust manner. This is a tough definition, but the key thing to remember about it is that the purpose of HTA is to provide decision makers in healthcare with complete and reliable information about the impact of a new technology, so that they can make well-informed decisions. In this context, technologies can, for example, be diagnostic procedures and treatments, medical equipment, pharmaceuticals, rehabilitation and prevention methods, or organizational and supportive systems for care provision. This last example also includes innovations in ICT and e-health. The focus of this lecture is on economic evaluations of such technologies, but it's good to understand that other arguments than value for money will have an influence on final decisions in the healthcare sector. Unlike in many other sectors, in healthcare, those who bear the costs and those who enjoy the benefits typically are different stakeholders. In most countries, governments or health insurance companies pay for healthcare, while the consumers of care, patients, enjoy the benefits. In addition, healthcare professionals like doctors or home care assistants and healthcare organizations like hospitals and home care providers may have an interest in the costs or benefits of an intervention. So, apart from an overall assessment whether a new service provides value for money, it's important to identify all the relevant stakeholders and the costs and benefits of the new service for each of them. Because, in the end, for a successful introduction of an innovation, you need to know who is paying and who is benefiting. Let me illustrate this with a real-life example. The Danish company DigiRehab has developed software for helping elderly who need rehabilitation services with a tailored physical training program in their own home. If this innovative training program is effective, it will improve the functional capabilities of elderly and help them to remain living at home independently for a longer period of time. This will improve their quality of life. It may also save costs to the healthcare system because admission to a home for the elderly is postponed and use of rehabilitation services is reduced. So, does this innovation offer value for money? And who bears the cost and enjoys the benefits? If you look at this innovation from the supplier's perspective, DigiRehab needs to develop and maintain the software and to train home care assistants to learn elderly to use the software and to monitor their progress with the training program. These are their costs. Their benefits come from the subscription fees. The innovation, of course, is only an interesting prospect for the company if the benefits exceed the costs. The innovation will need to be implemented by healthcare professionals in the home of the elderly. For example, home care assistants will already visit the elderly for other purposes. This innovation leads to diversification of their tasks, and they get to spend more time with each client. It looks like they primarily experience benefits. From the perspective of the elderly, there may be costs and benefits. They need to invest time in the exercises, time they cannot spend on other activities. But they receive the benefits of a tailored training program, which is expected to improve their functional capacity. In addition, rather than having to visit a rehabilitation center at fixed times, they can do the exercises at their own convenience. From this, it seems likely that elderly will ultimately perceive this innovation as being beneficial. In the Danish context, the municipality is responsible for rehabilitation and will need to decide about adopting and paying for this innovation. The costs include the hardware and software the elderly need and the extra time of home care assistants. The benefits include anticipated reductions in healthcare utilization. An economic evaluation study would show whether the benefits outweigh the costs for the municipality. From a societal perspective, all these costs and benefits are relevant. The key question then is whether society will be better off from adopting this innovation by DigiRehab. However, even if it provides value for money from a societal perspective, it is uncertain whether the innovation will be implemented successfully. As you can see from the table, individual stakeholders each have their own barriers and incentives for adoption of the innovation. The take-home message from this example is that apart from assessing whether an innovation provides value for money, it's important to understand how costs and benefits are distributed over different stakeholders. Concluding, economic evaluations provide systematic information about the costs and benefits of a new service. It helps us understand whether an innovation provides value for money, but also who bears the cost and who enjoys the benefits. But, as I mentioned before, economic evaluations are part of a broader approach to decision-making in healthcare called HTA. The economic evaluation, which is a fairly technical exercise that follows specific guidelines for the calculation of costs and benefits, feeds into a more normative and judgmental appraisal process in which other arguments may play a role, like social and ethical issues. As a result, a positive outcome in the assessment phase, saying that your innovation provides value for money, need not necessarily translate into a positive appraisal, that is, adoption of your innovation. Thank you for your attention.